The session was just on chronic graft-versus-host disease, with the first talk provided by Stephen Pavletic from the NIH on staging and diagnosis, the second part on first-line treatment provided by myself, and Attilio Oliveri at the end provided a talk on second-line treatment of chronic graft-versus-host disease. The first talk was on the development and the application of the new NIH criteria on chronic graft-versus-host disease and the effect this new proposed criteria had, where we are now in the position, thanks to standardized criteria, that we have the first drug approved for treatment of chronic graft-versus-host disease. And we have a lot of trials recruiting, including trials which would cover first-line treatment of chronic graft-versus-host disease. My talk was on first-line treatment, which summarized basically the don't knows of the field, because the randomized trials on chronic graft-versus-host disease were either from the 80s, so meaning from a time where practice patterns were quite different than today, or didn't ask the question what would be the standard treatment for first-line treatment. So this will hopefully change through the next 2 years, because 2 trials recruit or stopped recruiting evaluating first-line treatment, and hopefully this will change to their practice. The last talk by Attilio Oliveri was on second-line treatment of chronic graft-versus-host disease, summarizing the increasing number of agents available with different biological mechanisms. He nicely showed that we urgently need randomized trials and controlled trials, as a recent review revealed that the more stringent the criteria are you apply, the lower your response rate you get, meaning that small phase 2 trials or even retrospective analysis overestimate the effect of the treatment, which then is not fitting with the perception in clinical care. And he also nicely showed 2 cases where we discussed the current problems we face with patients requiring different treatment lines until resolution of chronic graft-versus-host disease is achieved. Finally, after the first talk, actually, we talked about the future of chronic graft-versus-host disease. And Stephen Pavletic just pointed out that he hopes that in 10 years we will be able to characterize chronic graft-versus-host disease much more based on biology than just clinical criteria, which will then lead to a tailored treatment.